With me having depression and having to sort things out before getting pregnant, as well as being diabetic, going somewhere like that, talk one-to-one with the doctors and the nurses and whoever helps, it was a lot easier, and it made me feel a lot calmer, and dealing with all the issues before getting pregnant and now pregnant, it just put us both at ease.
When I went to the fertility unit initially, I did ask them if I could be referred to a specialist, and I didn't really get a reply. And that's when I went to my doctors and spoke to my nurse, and I got seen by Dr. King that week. If I hadn't have had that support, then, you know, well, God forbid what would have happened, but, you know, they just, when I was feeling like I couldn't carry on with it, they were there to help me.
I just want to say how much more convenient it is for us diabetic, want-to-be mothers who work full-time to have support out of hours and also by email. I work 9 till 5, 5 days a week, and when you're trying to keep it quiet at work that you're even trying to conceive, it is more than helpful to be able to speak with someone after work, via email and also over the telephone.
I know that a lot of women with diabetes don't plan pregnancies, and I can understand why. There's a lot to worry about between blood glucose levels and the worry about complications such as heart defects, neural tube defects and stillbirth. However, the close contact that I've had with Dr. King and her team have transformed my experience from a potentially very stressful one into an enjoyable one. They run a first-class service, and I felt very privileged to be part of that service.
I feel very passionate about Proceed, and I've been inspired by the feedback we have been receiving.
Proceed to me is being able to give care to a patient right from preconception through to a successful pregnancy at the end.
I am based in primary care. I was part of the diabetes team based at the hospital until about 2 years ago. And I think the real sort of significant thing for me has been able to see the ability to be able to see patients locally.
There are two aspects of Proceed that have been inspiring. Firstly, the fantastic team that I work with who've been enthused and gone over and above to make this project work. It's also been incredible when I've seen a user who's previously disengaged with diabetes services come up and engage with us for preconception care, and the pleasure of that's indescribable.